Oh, great. So let's open it up to you and to your questions. And let me ask each of you to identify yourself and then give your question. Rodrigo.
Rodrigo Guerrero from Cali, Colombia. Well, there are some comments more than questions. I enjoyed very much the discussion, but having spent my life I am an epidemiologist and biostatistician by training, and now I'm a politician. So I can see both sides of the equation. First of all, the biggest enemy of data or evidence is publication of data. Those issues become extremely sensitive when you get across nations and you begin to publish homicide rates. That has profound implications in the economic life. So they will be the first against publishing or gathering data. So the same thing goes inside the country. We are going through that in Colombia. We in Cali are extremely fussy about collecting data. Other cities, not as much as we are. So we always come out worse than they, and we are extremely sensitive. So that enemy.
So what do you do about that? You are the mayor, and you are gathering data that portrays your city in a bad light. What do you do?
Well, that's the problem so far, I have resisted the temptation of going to using, I use the international criteria. Any injury, any death caused by an injury after 30 days, it will be a homicide. In Colombia, 3 days or 4 days afterward, they are not considered a homicide. So we are always come out worse. So far, I have resisted the temptation. We are going to have a meeting for all cities of the country and make the same standard so that we can compare each other.
So you are pursuing truth.
Right. Second, I think the most important difficulty is the attitude of the decision makers in utilizing evidence. Most of the time, evidence exists, but they don't like. We don't like to use it. It requires a change in attitude that politicians discover that this is extremely important. One basic requirement is that it shows that it works. Politicians tend to be very practical. So when you approach them, you have to give them something that really works. So that if they commit themselves to that, they will be having something to show. And then most of the time, in the political environment, it's extremely difficult to conduct the case control, double blind, all this kind of fancy study that we do normally to gather evidence. So you don't pretend or ask politicians to conduct at a city level or a country level this kind of experiments. That should be done by the academia. When they reach the decision makers should be prepared. Just to remember, the politicians are very practical. It reminds me of the famous story of mathematicians and politicians that are in one side of the room, and on the other side there is a beautiful woman, and they are told, that woman is yours with one condition: you should approach her half the distance each time. The mathematicians say, "Oh, I'll never make it," and the politicians will say, "I will get close enough." So most of the difficulty, we have evidence to make decisions which are on the evidence which might not be as good, as powerful as we need it, but it's sufficient to make it. So that's it.
Thanks, Rodrigo. Let me just, for the record, change your example and say there is a beautiful person on the other side of the room. And one of the things you say, one of the obstacles we face here is what sometimes we think about as a joke, that a politician says, my mind is already made up. Don't try and confuse me with the truth. Don't confuse me with the data. I have my attitude. I know what I want to seek. And so it's interesting that you face the challenges from both sides or now have the chance of moving forward, going back and knowing it for the first time as you move forward from a unique perspective. Thank you very much. Other questions in the corner?
Thank you.
Wait, Colleen, behind
Oh,
you, there's someone, and then I'll
sorry.
give you a chance.
Thank you. Brian Bumbarger, the Prevention Research Center at Penn State University. I want to ask the panel about a different way of thinking about evidence related to decommissioning, something that I never hear discussed in the U.S. It's something that's a fairly common term in the U.K. Think about the term evidence and things that are evidence-based, programs or strategies that are evidence-based. And we think about, well, we want to collect evidence and use that evidence to determine what works and promote the dissemination and implementation of those things that work. But in the same process, we gather evidence about things that don't work. And if you think about evidence as a continuum with an infinite number of points along that continuum of confidence, the opposite of the things that we have great confidence that they work on that continuum of evidence is not it's not things that don't work. It's actually things that we have great confidence that they don't work, or even things that we have great confidence are harmful, iatrogenic. So how do we go? I mean, I think that is, when I think about evidence in violence prevention specifically, or in social behavioral problems, I think that's the low-hanging fruit. How do we decommission things that are already in widespread use and sometimes very politically popular, that have really good evidence that they don't work and in some cases are even harmful?
That's, again, a very good point, Brian. I don't know if that was a question that any panelist wants to comment on.
I would just say I think it's very, very important that we do speak clearly about what we know does not work. And we really grappled with this question when we put together our crimesolutions.gov website, which, Phelan, if you want to raise your hand in the back there, is going to speak about in more detail later today. But there are programs that my agency funds, for instance, that we really don't, we're not so sure that they work. Why are we funding them? That's another question. We don't have control over all of that. But we were concerned that there would be a huge backlash. What do you mean my program wasn't rated as being evidence-based, and you're not saying that it works? And we decided that's our obligation. We need to do that. Now, we don't say this doesn't work at all. We say insufficient evidence, which is kind of an obvious label, I would think. But it is it's a real challenge. Scared Straight is a perfect example of that. Bring a 12-year-old down to the local jail and have him, and let the inmates scare him straight. Well, we know that not only does it not work, but it's actually harmful. And to this day, there are communities who just will not let go of that notion. Boot camps, very popular, no evidence that they really work. And that's what happens when people go, when people make policy or implement programs based on their gut or their own childhood experience or whatever. It really does emphasize how important the evidence is.
Can I just add to that? I think that's absolutely right. And I feel like the key issue there is political will and commitment. I mean, you need someone high up in that organization that's going to say, you know what, we're just not going to do this anymore. And I think, you were talking about Janet Reno was someone that, I mean, I think that there are leaders out there that think that way and that understand that. But at the end of the day, if you don't have that, it's really difficult to do. And so that's part of the challenge is
Mark,
sure
could I give an example of a way that we are thinking about decommissioning in the U.S. government at the moment? Yes, at the Administration on Children, Youth, and Families within the U.S. Department of Health and Human Services, we've been using the term descaling to think about how to decommission programs that are not working. Two professors at Stanford have been playing around with this notion of descaling, and over the last 2 years in all of our discretionary grant making and in our major policy lever, our 4E waiver, which is a technical term for how states use their child welfare funding, we've said explicitly, as you are scaling up evidence-based practices, we want to see a very clear attention to the descaling of things where there is no evidence or there is evidence that it is harmful.
Thanks, Claire. Colleen?
Great. Colleen Scanlon from Catholic Health Initiatives. And really speaking from the perspective of a healthcare provider that has health systems, entities working in communities across the country who really see this issue as a community-based issue. And I think some of the biggest challenges we have are really trying to, and these are community members that may be working with local governments and municipalities, but it's churches and schools and businesses who see violence as a reality in their community and want to respond to it. They're not researchers and they're not scientists. And so they're advocates and are looking for ways to partner in the community to address violence. So the issue of the sufficiency of the evidence to which they base their actions and implementation programs on is essential. Their sense of immediacy, of need and concern and wanting to act but in a way that seems meaningful but may not always be, evidence-based. And then trying to translate what we know in a meaningful way to these community members is a challenge that we face as a partner in those efforts. We don't lead those efforts. We see ourselves as a partner. But I think at a community-based level, we really need to build the capacity to provide information and data in a user-friendly way to allow them to act now when they see the immediacy of their concern because they've had a recent episode of violence, or there's increasing data about the evidence of some form of violence going up. So, there's something about the science that we need, but how we make that meaningful in communities across this country that are very varied, I think is an enormous challenge for us.
A point that you make, violence in all its forms, whether we're talking about what happened at Newtown, Connecticut, or whether we're talking about a family that's in disarray because they've discovered someone abusing a child within the family, or whether it's a suicide of someone that we really care deeply about, violence in all its forms is highly emotional. It's highly charged. And what Mary Lou talked about as expediency, to act now, do something now, is a force that we will encounter in every area where we look. And it's a very important point. Thanks, Colleen. Last point, and then we'll finish. Daniel.
Hi, Daniel Webster, Johns Hopkins. I just wanted to follow up on a couple of comments. One from Mary Lou pertaining to sort of labeling something as insufficient evidence that actually there is evidence that it doesn't work. I really would caution against that because just in my own, one of the areas I study in gun policy, when this task force for preventive health services looked at gun policy research to try to ascertain what do we know about that problem, for a whole lot of the policies, the word was insufficient evidence. And it actually was not always the case that there was evidence and nothing worked, but more commonly the evidence, either it was unstudied or studied with very poor quality and design and data. And people have used that insufficient evidence to conclude that a whole range of gun policies don't work, so why bother? So I would be very cautious. How one labels the evidence matters, I think. And then I also just respond to Dr. Guerrero with respect to sort of the political aspect and tensions. In studying gun violence, there's a lot of evidence that probably in an increasing way, law enforcement leaders who are held accountable at various levels, where you're talking about a precinct, district, or a police commissioner or a city, for the crime that's in their area, there's enormous incentives to not report violent crime. And just as we see with the greater emphasis on testing in schools and people's jobs depend on those tests, the same applies in law enforcement very much so today, that people know that their jobs are on the line based upon the crime that gets reported. And what I and many researchers have done in response to that is often just trust the homicide data because they're hardest to hide. But the more I'm becoming more and more dissatisfied with that, because while I've always felt, and that's why I collaborated with Jackie on the high end of the spectrum of severity is very, very important in homicides, it's not the whole thing. There's a whole lot of important violence that I think is being measured quite poorly and really is an impediment to us evaluating evidence about the nature of the problem and what to do about it.
Thanks, Daniel. So I think you'll see that these questions are far from settled. I think our panelists have presented it so that these questions are far from boring or dull. And these are really critical issues to the work that all of us care so deeply about. And we will be coming back in the rest of these 2 days to pursue a lot of these same issues in more depth. But again, join me in thanking our panel for their contributions here.
I'm going to interrupt for a moment so I can eat my own words. Phelan reminded me that it isn't insufficient evidence that connotates the programs that don't work. It's no effects. So we have an insufficient evidence that we don't know yet whether it works. But then there is a fourth, which I completely forgot about, which is no effects. So you know what no effects means if you're looking at that particular program. So thank you, Phelan.
If we could please reconvene at 5 after 11? At 11. Please be back here at 11 o'clock. Thanks.